Conor is 3. At the beginning of this year, his father Chris responded to a BBC advertisement about therapy for families who were worried about children under 5.
Don't you bite. Don't bite.
His mother Tracy hoped he was just in a difficult phase and wanted them to work things out at home.
Conor, no, not you dare pinch. Oh, stop doing that.
We just normally just spend time together. Here, I might take him swimming tomorrow morning.
Do you like swimming, Conor?
Conor, stop. We just want him to stop. We want him to know the difference between right and wrong. And that's what we're not getting at the moment. If you scream and shout at him loud enough, he'll stop. But I don't want to scream and shout at him so loud, like, Conor! And it's just getting away from that screaming at him to stop, to saying, Conor, stop. And he'd stop. That's all we want, isn't it?
There's a bastard round and round, round and round, round and round. There's a bastard. What's that?
Well, no, I just don't think we needed to see anybody. And neither of us were used to children. We hadn't had any experience of children. Maybe if we'd spoken to friends and other people in families and that, we would have worked out. And
We did. We'd speak to loads of people and everyone give us different advice.
Yeah.
Didn't they? Everyone. We'd never had real proper advice where we could go back and talk about it.
Just listen to other people's experiences and...
Yeah, and everyone's was different.
Yeah.
So, what we did in the end was we went and talked to people who were experts in the field.
You did, yeah.
You did as well, you were there.
The help on offer was from the Tavistock Clinic in London, the country's largest NHS centre for psychotherapy. Its child and family department sees 2,000 cases a year. The most troubled patients may come for years, but their under 5 service tries to help in a matter of weeks.
No, you don't bite.
Don't bite.
In you come.
No.
Nobody wants to go to a child guidance clinic. It's a bit like going to the dentist. You really wait until you can't bear it any longer. The difference between dental problems and mental problems is that you can easily pull the tooth out or get a hole filled, but actually the treatment of mental problems is very much more complex. And we now know that most of the problems that present to us in childhood do not remit. They may change, but they don't tend to go away. They may change into something else.
Let's go. Okay.
The family were referred to child and adolescent psychiatrists Sebastian Kramer and Sarah Weineck. They are doctors and can prescribe drugs to children with behaviour problems. But for this case, they'll start treating Conor by closely observing him and his parents. They believe Chris and Tracy may hold the key to their son's outbursts as much as he does. The therapy was filmed using 3 small cameras operated from behind a 2-way mirror.
Cars, Conor!
Yeah, is cars good?
Right, sit down now. We're going to lock it now.
Yeah, I think we ought to.
Yeah.
Do you want to talk about it anyway and see how we get on?
Yeah.
Tell us what led you to want some help.
At play school and his play groups and wherever he goes, they always say that Conor has hit someone or scratched someone, pulled their hair, and it was a regular occurrence. And in the end, we'd go to play school and say, "How's Conor?" It's always just been Conor. There's no...
Unless he'd done something really bad, they'd stop telling us in the end.
Now.
Yeah, they'd stop telling us. They would just say, "He's been Conor."
Conor, no, you can't play with plugs. Conor.
You probably
can't play with plugs.
have to
Connor.
take charge.
No, you can't play with plugs. Plugs are dangerous.
Conor.
And turn switch off.
Yeah, look, I'm turning it off, but you must leave it alone. No, you mustn't put your fingers
Conor,
into
don't.
plugs.
The proportion of boys to girls in child mental health clinics is about, perhaps 2 to 1 is a bit excessive, but it's of that order. Far more boys come to child mental health clinics. In adolescence, the proportion changes and girls tend to predominate with eating disorders and overdoses and so on, and depression. But it's clear that little boys are more visibly distressed than little girls. So I'm not saying that little girls don't suffer, but they may not show it until later. So what we see is a lot of boys with an awful lot of energy and an awful lot of destructiveness, anger, all the things that people are familiar with about boys, but which gets really out of hand and requires professional help. So let's go back to baby Conor.
No.
Oh, well, your mum and dad's going to tell us what you were like when you were a baby.
He's always been happy. You know, he's always been a happy boy, and even when he was a baby.
And before he was
good.
born, was he a lively little baby inside you, or was he quite calm?
Well, the story basically is that Tracy couldn't have children. She was told.
Couldn't have children.
Yeah, well, I was told I couldn't have children.
So we think that he came out fighting. He said, I am going to be born.
Well, they didn't say I couldn't have children. They said I'd probably have to have IVF treatment if I wanted children.
So what age were you when this happened?
15.
15, right. So as a baby then, he wasn't restless and difficult.
Not
he
at all.
slept well, he fed well.
He sleeps well now.
So when did he start to be like this?
The minute he could start to walk.
He started to walk.
Yeah.
Open that door.
And he started, I mean, I can't think when...
Listen.
Because he was such
Won't
a
be
happy baby.
Yes.
Everyone loved looking after
Yes.
him up until he
Yes.
got to about 18 months old, and then offers stopped.
Soon.
And that's when he
You'd start
started being...
asking and they'd go, no, 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 it's too much like hard work now.
Did the same thing happen to his grandparents, that they loved looking after the baby and then stopped wanting to look after the little tearaway?
No, my mum looks after him a lot still anyway.
And how does she find him?
Hard
Yes.
work.
Yes.
Is that the Nana he was talking to?
Yeah, Nanny Pat.
And what does she think?
Turn it off.
Does she give you advice about this? Does she say what she thinks
Well,
you
no,
ought to do?
because she said, you weren't like that.
You weren't like that. What did she say you were like?
Well, I was a sweet little girl. She just thinks
Right.
it's because he's a boy that he's like
Right.
that.
And haven't you got any brothers?
No, no,
Have you got sisters then?
no.
So you're just the only girl? So what kind of little boy were you?
We have to let down now.
I think my mum's not really said much. I went through a lot of trauma. My father left my mum when I was very young.
Right.
No, you don't
So
Come here, bring the chair back.
Oh, wait, let's just deal with this.
Bring the chair back. Let go. Let go of the chair. Let go.
He's very determined. And he knows that he can't go out, so you'll have to...
Connor, you know you can't go outside.
So carry on with the chair.
Let go.
You can't go outside. No, later. I'll tickle you. I'll tickle you. I'll tickle you this
Come
side.
on, let go.
I'll tickle you.
Why don't you come and sit here and play with the
Come and give me a cuddle. Come on. Come on.
You're
I'm tired. He's not tired. That's his excuse for being naughty.
Yes.
No, let go. Please let go of the camera. Let go. Let go. All right. Come on.
What a strong boy.
When I was 6, they separated.
Yeah.
And he played a game with my mum called Spoil Me, and my mum's got no money. And it was a sort of affection game. And in the end, I left my mum and lived with my dad. And he took me to Scotland. Now, I'm from Portsmouth, and it was a long way away. And he played these games for many years with my mum. And it was only when he couldn't handle me anymore, he actually got remarried. And the lady he married hated my guts, basically, and sent me on the train back to Portsmouth on my own.
How old were you then?
I think I was about 7.
You went to Portsmouth on your own?
From Scotland, on a train. Sent me back to Portsmouth.
How did you change trains in London?
I can't remember, but I did it. I had all the instructions. I think I was only young. I don't remember much of it at all. All I remember is I couldn't take my Monopoly set and my games with me. I just had my clothes, and there I went on this train.
It's a very sad story, really, isn't it?
Is that Daddy's hair? I'm going to rub your face.
Stroking Daddy's face.
Do you like Daddy's hair? Can you give me a kiss?
No,
Just a little one. Please.
I'm tired.
Are you tired?
Yeah.
Do you want to sleep in Daddy's lap? Oh, you lean back. Oh, yeah.
I'm
Adults reveal thoughts and memories in conversation, but to understand what's going on in Conor's mind, Sarah and Sebastian will closely watch and then interpret how he plays.
And he's got a fixation with doors at the moment.
He has got a door thing at the moment.
I'm going to lock it if you're going to keep opening it.
Really,
You're going to leave it alone? OK, good boy.
Well, that worked, didn't it?
Do you want crocodile back?
What's this?
Oh, you have a look.
What are they, Connor?
Can you take them off? Turn it upside down.
Oh no, you're going to put them all back on properly.
No?
No?
Not going to put them back on?
A green.
A green? No, I don't want to thrown at me.
Connor!
Right, sit down. You don't throw things, do you?
Thank you.
Connor! Listen, I want you to say sorry. You say sorry.
It's OK. But you must
Don't
throw
do
things
this again.
See, what happened there was quite interesting, isn't it? That actually Dr. Wynick got him to agree that the door didn't need locking, and he calmed down and he was going to play, and then he got, as you say, anxious,
Go
I
and get the
think.
green one.
That actually it's just too much for him to manage himself at that point, and so he had to throw them around, and even then nothing happened. So he had to do something even worse.
We got it.
And then he got
Let's show me got it.
he got
with him.
control.
You put one
again. Am I due for a hit now, do you think?
No, not at the moment.
I didn't think so.
It's me
We
who's...
got last one.
Daddy put it on his head.
It's a vitamin.
Is it a vitamin?
Yeah.
Which one's the elephant? Yeah, that's an elephant, isn't it?
What's the elephant doing?
Well, there goes the elephant. Can you say sorry to the elephant? You're going to give him a kiss?
I'm broken again.
That's not very nice, is it?
Watch it broken.
Why do you want it broken?
I think things that are broken are worrying to Connor.
Well, we saw a car crash the other day, didn't we, outside our house. We didn't see it actually happen, but the car turned over on its side, and that affected him. He was going around saying, car's broken.
Yeah.
And then he turned every car over like that.
It's very observant.
The wheels were going round and round because I think
that
the
scary?
wheels were obviously spinning.
And on the road. I can't come.
What colour was it?
It's
Yeah,
dark red.
yes.
A dark red car had a big smash and turned over on the road.
I think Connor's very worried about things going out of control, isn't he? Things going wrong.
Yeah, I think you're right.
I'm sure you're right that he would have been influenced by that because he feels that he's a sort of car that crashes all the time.
You were talking to him really nicely there, you know, and you won the battle with the door.
And then you got the green donut.
Then I got the smash. Yes.
Yes.
Where's your coat gone?
Play is really the way with small children that you get a window into what's going on inside their minds, that a lot is played out. And one of the things that you're doing is seeing whether that's of any benefit to the child, whether they can use that interpretation, that understanding of their play and do anything with it. And it was actually quite clear that Conor could.
I want to tell
Do
you
you think
something.
there's anything we should look for?
Oh, you're going to sit on my chair, aren't you? I'll have to come sit here then.
Well, I think what Dr. Wynick was saying is what you've spotted, actually, this process of him thinking that something's going to go wrong and even making it go wrong. So I think that's what I would look for, is the pattern there of things.
No, not a pattern.
Not a pattern. I'm sorry, Doctor, you're quite right. Not really a pattern.
You're going to go around Nanny Reenie's this afternoon? You're going to go around Nanny Reenie's?
It's already been round there. It's been too late.
Tracy did not like her first experience of therapy, especially the interest in their personal histories.
I don't really think going into all our backgrounds had anything to do with it, to be honest. It didn't seem to bother Chris, it bothered me. It really bothered me. Because I didn't see how especially my personal previous medical history, I don't see what that had anything to do with why we were there. I really don't feel it had anything to do with it. I know. Maybe I'm silly, but I really don't. And Chris went into depth talking about it.
I agree with Tracy. Maybe I did definitely say too much. But in a therapy, as for therapy, I don't know if it was needed or not. I've come a long way since I was, you know, that little boy on a train. And it's not really affected me. I've never really talked about it before, to be honest with you. So
you didn't feel that was relevant?
I don't feel that they're the route of questioning at that time was right. You know, if it's nothing significant, things that are personal to you just should remain personal to you, I think, or kept within the family again.
La 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 la. Chihuahua.
Tracy's family live round the corner, and Conor spends most afternoons with his mother, grandmother and great-grandmother.
I'll never get there, will I?
We're nearly there.
Yeah, we're nearly there. You've got no shoes on, nor have I, and well, we are a pair of little ways, aren't we? I'm only going to sit here, so.
Drink your water.
Drink your water.
He spoke quite quickly, didn't he? And his ABC and numbers and everything, you know, he's quite well advanced, I think, really, for a 3-year-old.
Did he remind you of Tracy at all?
Yes, a bit.
Look-wise.
Yeah.
Character-wise, is nothing.
Oh no,
like
not
that.
character-wise. No, Tracy was a lot quieter and more well-behaved.
I never did anything wrong.
She didn't, no. She was a typical little girl. She played. No, she wasn't a typical little girl. She was a tomboy. Hence the garage with Tracy's garage on it. My brother bought her. As Conor's age, she'd walk along the street and go, "Oh, that's a Ford. That's a Bentley. That's a Mini Minor, Morris Minor." She knew them all.
Don't forget it then, will you, for me? Because I won't know where it is, will I? Don't do that, darling. No, Conor. Oh, you mustn't do that, dear Conor.
You know, some boys like to play with dolls. Conor doesn't. But Tracy never really wants to play with
Behaviour-wise,
them.
boys tend to be more...
They're more boisterous,
More
aren't they?
boisterous.
Mm.
More like people say, typical boy.
Oh, sweetheart.
What's that?
Oh, Conor, I thought you'd have known
Is
by now.
it hair?
No, it's the brush.
No, don't touch it.
No one hasn't got brush.
No, I haven't got a brush. Okay.
This one has.
Come, you can help me down the bottom.
You're going to help Nanny down to the living room for a minute?
He knew all about plugs before he could talk.
He's definitely been here before, I'm sure he has.
Electrical-wise, it's just... Because everyone used to say he's going to be a Sparky when he grows up. Everyone used to say it because he'd crawl over to the stereo. I mean, that's why we haven't got a stereo in the living room that works. He broke every CD player we ever had, every speaker we had, just to take it apart.
Well, my mum's had a radio about 3 times because each time he's had the radio and fiddled about it so much, he's broken it. Televisions have gone, you know, wrong and everything, but that... There he is again.
Chris and Tracy spoke a lot together about that first meeting at the Tavistock. She was in 2 minds about going back, but a month later agreed to another appointment, as long as it was without Conor. Meanwhile, Conor had stopped biting people.
How have you been? How's Conor been? How's things been since we last met?
We had a disaster after we met you. It was as if Conor knew what we were saying. Because the next day, I took him to his favourite place, where he is now, actually, the ballpark. And what we do is, it's a stop-crash thing, and they look after him, you can go and do your shopping. Well, what did he do that day? He bit 2 people, and he bit them and clung on.
Right.
But since then, he's been perfect. He hasn't bitten anyone, has he?
Well, you said perfect.
Well, I mean, he hasn't bitten anyone.
Because I was curious, but are you connecting that to his experience here? And I wonder how that worked, you know, whether he was reacting to what he'd heard you saying or to what it was like for him. What did you think?
I don't know, I think it just distressed him, didn't it?
What do you think he might have heard that would upset him? Because I could see that it is a pretty strange situation. I mean, quite apart from cameras, you know, four walls, it's fairly enclosed, the curtains drawn.
Just probably the fact we were discussing him without actually including him.
I think that's so.
And he doesn't like it.
No.
As most people probably don't like to be talked about.
I think you're right.
And I don't know how he did, but it seemed he reacted for the next 2 days. He was horrible.
Yes. And in your own minds, have you re-evaluated since then?
I think so, yeah.
What's the re-evaluation?
We've seen the sensitive side in him, haven't we? We've seen
I think it's not just what we've seen in him. I think I myself have tried a lot more to be more understanding with him. I try and reason with him a lot more than what I used to. Instead of just shouting at him, which does no good. You know, I can shout till I'm blue in the face. Occasionally, I do still shout at him, but now if I shout at him, he stops immediately. Instead of, whereas before I could just shout and every kid in Bermondsey would stop except for Conor.
It's true, a wonderful idea, wonderful picture, that.
I think we often see that things get worse before they get better, that there's something about focusing on a problem that sometimes makes the child feel they need to do it even more for a bit, just to get across whatever it is that they need to communicate even more so, or to say, well, let's see what happens if we kind of escalate, and then something changed and something got better.
It's just a bit like medicines, isn't it? I mean, it's got to get to a certain blood level. You know, if you take a medicine, it doesn't just work immediately. And I think that the medicine in this case is some kind of reflections, which, as Sarah says, may not have struck them immediately. So it takes a bit of time to circulate around the family. All of them are thinking different things and wondering about things, not necessarily consciously all the time. So in the system, if one can use the word, the family system is changing slowly. What do you think led to that re-evaluation? Was it something in your own minds before you came here that you began to see that, or was it after you came here, or was it just in the fullness of time?
It's just come about. We've talked about it a lot, haven't we? Yeah, just that we have to understand him more.
I do believe that something you said on the first one about how a sensitive little boy is. I think I needed to be told it, because after it was said, I really did. I saw it and saw it and saw it. You know, I don't know what... I knew he was before, to a certain extent, but I never really thought any more than that.
Is that something to do with boys, your idea of boys? And your expectation that boys... I mean, because you told us that rather touching story of how you at 7 got sent across the whole length of the country. I mean, the idea that boys just have to sort of be tough and not be sensitive, when, of course, we know, actually, that boys are very sensitive when they're little. It's quite often ignored. But do you think it's to do with your own... upbringing, that you hadn't appreciated that he would be sensitive, just as sensitive as you were?
Maybe, because I'm not really that sensitive now, am I?
What I mean is, you've got to be sensitive to see that somebody's sensitive, so you must be sensitive people too, that's really all I'm saying. And that perhaps he'd got you into a position of being confronting with him, as you say, sort of shouting, so that the sensitivity in you and in him was ignored. Well, given that our upbringing as boys tends to be, or has tended to be, rather restraining, the idea, you know, that if you're a boy, you're not meant to be too emotional, for the reason that, you know, the emotions are so troublesome, so you put them out of the way. Now, if you become a father, some of these emotions come back, and I think a lot of men have quite a lot of difficulty in knowing what to do with these emotions. They may really adore their children, but feel that it's not quite right to show it.
I don't know, I just think that there came a time in about March this year when I realised just how wonderful he was. Whereas I probably didn't realise that before. I thought, you know, this guy's hard work. And all of a sudden...
And that is what you always used to say.
Yeah. And
He always used to say, oh, it's so hard work, it's so hard work.
Well, he was.
No, he wasn't, because you weren't listening to him.
I often think that it takes fathers a bit longer to catch up to loving their children, really, to adoring them and admiring them. Tracy had 9 months to get to know him before he even appeared. And I think fathers just take more time. And it sounds to me as if this discovery of his sensitivity is something to do with acknowledging that you've got him now and you love him. And it is enormously hard work looking after small children, even one less active than him, actually. And I wonder if that sort of turning point is quite important, that your recognition that actually he is going to change your lives. You know, and at first I think you might have resented that.
I think you've hit the nail on the head, really. I think so. I do, don't you? Because in the beginning it was, you know, hard work, as you say. And as I said before, you know, it has made us look at our lives, hasn't it?
If you go to the surgeon with something you don't like, you ask the surgeon to take it away. But if you come to a child mental health clinic with a problem, its going away happens as a result of it fitting into a story that is being told about family life, about family development. It's the opposite to surgery. So what we're doing is actually removing the offending item by making sense of it. There again is a paradox that by understanding something, it changes. And I always found that very puzzling when I first read Freud as a student many years ago. I thought, well, why does knowing about something change it?
I must admit, I felt a lot warmer to them the second time. The first time I said he looked like the typical nutty professor, I think.
Don't say that.
But he did, didn't he?
See, you're doing it again.
I did. I thought he did. But as I did warm to them, and I did see them more. You know, I like their company. You know, the second and third time. But it's true. There he goes again, spouting his mouth off. We've got to take the grass away.
Yeah.
We're putting it on the track.
Yep. It's got to be on the track.
God, look, that's dangerous for the car, isn't it?
Why?
Because the car will fall off the track. Crash. Push it. I think it's a lot harder to be a good father than be a good mother. I think you really, I mean, I don't say who is a good father, but I really think you have to look at yourself in the mirror and say, you know, am I doing good for my little boy? Or is it just so easy to plod through life and then he's 1, he's 2, he's 3, he's 4, he's 5, he's 6, and then you've missed him being 3 because when he was 3 you thought he was 4 or 5 and you had no time for him. Oh, you can talk now, go on off, you go in the garden, go and play. Instead of saying, you know, so what's this, Connor? This is my house. Should we play in your house today? You know, there is that way of being a father.
Let's go outside.
Are you going outside?
Yeah.
Shall I go outside?
No,
Oh, that's not very nice.
Dad!
No, I'm not here.
Why?
I've gone out.
Are you there?
No,
Why?
I'm not. I've gone out. Are you putting grass on me? You don't put grass on me. Daddy's running away. Daddy's running away. Becoming a father, I think it's like being a pet. It's just discovering, isn't it? Discovering yourself and discovering your kid. I think I'm the only one who really draws out of it. Although Tracy draws the fact that I've made.
Well, no, we've all benefited because he's benefited from the talking, even if it was a discussion in the back of a cab from me. Because we wouldn't have had that talk had we not gone there.
You see the helicopter? It's not going to
In that sense, it helped Chris to talk about it. And in turn, Colin has got better. Probably because both our attitudes have changed towards him, especially Chris's.
Chris and Tracy didn't think they needed any more help from the Tavistock, but they changed their minds when they found out that Tracy was pregnant.
We weren't sure whether we were going to see you again, and pleased to see you. What have you been thinking about in the meantime?
Well, not so much Conor as a Conor thing, more of the, as we said, Tracy being pregnant, more how it's going to influence Conor and our feelings, you know, the way we react to Conor.
We had been trying for a long time, because obviously, like I said before, I've had 2 miscarriages, so it's not the first pregnancy since Conor, so...
I think we're more prepared now, aren't we, mentally?
I was obviously, for the last few weeks, I've been preoccupied with
worrying.
With myself, worrying myself silly.
What stage were your miscarriages at?
12 weeks, both of them.
And you've passed that now, have you?
I'm 13 weeks now, but I had a scan last Thursday. And baby was fine, everything was fine.
So I've
had a scan every 2 weeks since I was 6 weeks.
And have you seen these scans?
Yeah.
So it's been a pretty anxious few weeks.
You say about what's our relationship been like? Well, it's been me going, oh my God, and him going, oh shut up, not again.
So he's not been as worried as you. You had to have all the worry, really.
No, but mind you, I was like that with Conor though. I was for the first few weeks, wasn't I?
Yeah.
Couldn't let him out of my sight.
We started because of the latch on, wasn't it?
I couldn't get him to latch on properly in the beginning, and just went from bad to worse from there.
No, it did.
But no, it did to me.
But the panic, what would it feel like?
I just have to keep checking on him every 5 minutes to see if he was still breathing.
Yes.
So how old was he when you stopped being so worried?
When he started climbing out of his cart.
And when you heard thump.
So really the first year was quite worrying.
I mean, it hasn't. I wouldn't say it's got easier and the worrying's got less. It hasn't, in fact. It's got harder and harder as he's got older, but I do still panic if he's not coming to me by 6 o'clock in the morning.
What is it you think's happened?
I don't know. I don't know why I just assume he's going to stop breathing. I just do.
And what other things do you worry about? You said it's changed. That's a surprise to you.
I still panic about it. I don't know why.
That little tearaway who's wrecking the computer down the road there.
But somehow there's a picture in your mind of a different kind of Conor. Not that robust, bouncy Conor, but a Conor
I think it just stems from me when he was small and I used to do it.
But in a way that's what I meant, was you still got a picture of a little helpless, frail baby somewhere under all that chunky Conor who can do all sorts of things. I suppose one of the things that I'm getting from you talking about the last 3 years with Conor is that he's a little boy who's not had to wait very much for anything, because you've been sort of quite kind of geared up and a bit anxious, that if he's cried you've fed him instantly, and if he's sort of if that wasn't the right thing you've looked for the next thing, and you've looked. So he's a boy who's kind of got used perhaps to having a mummy who's doing her job 110%, which is in some ways a lovely thing, but in other ways can make him kind of expect that, and then it can be quite a shock when he doesn't get that.
Yeah, but that's what you're saying, he's had it from both of us as well, because I'm at home a lot.
So he's had more of you than lots of little children have with their dads.
Yeah, well, more of both of us, I think.
Sometimes waiting is good, because you develop a sense of you can wait and it's not the end of the world, that the world doesn't fall apart if you cry for 5 minutes. You can find something within yourself that can help you to wait. It doesn't have to be Mummy and Daddy rescuing you before you even have the feeling.
What are you going to call it? Call him? Conor. You can't have 2 Conors, can you? Can you think of another name?
Conor, didn't you want to call it Jazz after your friend? Jazz.
You're devouring now, aren't you? You can go and look to see if there's any strawberries in the garden. Go on then. And if you find a strawberry, can you come and give it to us? And then we'll wash it. OK?
Tracy reached her 20-week scan, more confident that the baby would be all right.
You go and quickly find this strawberry, OK? Tracy, you were worrying so much, weren't you, for so long? So give it a chance, you know? You've really got to give it a chance, but she wouldn't give it a chance, would you?
Can't help it.
I know, but that's the way we're both very different. Is I'm more laid back, whereas you're more. Mind you, you've gone through 2 miscarriages where I haven't, haven't you? Which is a big difference. And I must admit, I didn't realise how much they had affected Tracy until we were talking about names, and she said she can't use the name Matthew, didn't you?
Yeah.
Because that was synonymous with one of them. Because I suppose I never realised how strong it hit Tracy until then.
Listen, I'd obviously, because the minute you find out you're pregnant, you do start thinking about names, no matter how early it is. And you just think, well, I knew you liked the name Matthew when I was pregnant with Conor. And that. So when I fell pregnant the time after Conor, I thought, if it's a boy, we'll call it Matthew. And of course, then I lost it, and I just said to Chris, there's no way I could use that name now, because I just...
Alright, son. Don't slam it!
Got 2.
You don't slam it. Do you want some more strawberries?
Yeah.
Right.
You get 2.
No, I've found some new ones. Right. Conor James, are you being a good boy?
Yeah.
Do you want to
I mean, if Conor was going through a phase, it was certainly a dangerous one. And had the parents not asked for help, he might have got better, but he wouldn't have got better quickly. And so he would have lost important developmental time, which we now know is time he needs to get ready for a new brother or sister coming in the family.
It's going to come on in a minute.
The first child always gets a shock when another child comes along.
Pop on the bed for me.
Yeah, get me out of the way, wouldn't it?
Not me.
I couldn't work the...
Not Conor.
Yeah, me.
tummy.
Come here, son. Don't turn anything off.
Oh, look.
Come
Right.
Easy. What are you doing?
Yeah, I should be on there tomorrow.
Just have a quick look at your notes. Got fingers in front of its face.
Chris and Tracy's baby is due this month, and they may return to the Tavistock after the birth. Tracy thinks Conor is going to get a little brother.
Not yet.
Why?
I think Conor will find it very hard at first, but I think he is already preparing to have a relationship with this child by talking to the child even before it's born. And I think he will both enjoy and not enjoy it, and that's how it should be.
This little belly.
It's got a belly like Conor.
It's got a belly like yours.
You can see the
This little
tiny
rib
things.
cage there.
Get Mummy's belly out. You're going to see it.
If you would like to know more about the issues raised in this programme, there's a BBC helpline. The number is 0800 88 8809. Calls are free and confidential, and lines are open until midnight tonight and between 9 a.m. and 3 p.m. tomorrow. The number again, 0800 88 8809.
Is the baby going to pop out?
Not today.
It's been up all night, that's why it's asleep now.
Been up. I know.
Look at that, Conor. Look at that picture.
Little heart beating there.
It's going to be brother or sister.